Today, we are going to talk about albinism. Albinism affects the production of melanin, the pigment that colors skin, hair, and eyes. It's a lifelong condition, but it does not get worse over time. People with albinism have a reduced amount of melanin, or no melanin at all. This can affect their coloring and their eyesight. People with albinism often have white or very light blonde hair, although some have brown or ginger hair. The exact color depends on how much melanin their body produces. Very pale skin that burns easily in the sun and does not usually tan is also typical of albinism. Eye problems. The reduced amount of melanin can cause eye problems. This is because melanin is involved in the development of the retina, the thin layer of cells at the back of the eye. Possible eye problems linked to albinism include poor eyesight, either short-sightedness or long-sightedness, and low vision. Astigmatism, where the cornea, clear layer at the front of the eye, is not perfectly curved or the lens is an abnormal shape, causing blurred vision. Photophobia, where the eyes are sensitive to light. Nystagmus, where the eyes move involuntarily from side to side, causing reduced vision. You do not see the world as wobbling because your brain adapts to your eye movement. Squint, where the eyes point in different directions. How albinism is passed on. The two main types of albinism are oculocutaneous albinism, OCA, the most common type, affecting the skin, hair, and eyes. Ocular albinism, OA, a rarer type that mainly affects the eyes. Autosomal recessive inheritance. In all types of OCA and some types of OA, albinism is passed on in an autosomal recessive inheritance pattern. This means a child has to get 2 copies of the gene that causes albinism, one from each parent, to have the condition. If both parents carry the gene, there's a 1 in 4 chance that their child will have albinism and a 1 in 2 chance that their child will be a carrier. Carriers do not have albinism but can pass on the gene. X-linked inheritance. Some types of OA are passed on in an X-linked inheritance pattern. This pattern affects boys and girls differently. Girls who get the albinism gene become carriers, while boys who get it will have albinism. When a mother is a carrier of an X-linked type of albinism, each of her daughters has a 1 in 2 chance of becoming a carrier. Each of her sons has a 1 in 2 chance of having albinism. When a father has an X-linked type of albinism, his daughters will become carriers, and his sons will not have albinism and will not be carriers. Genetic counseling. If you have a history of albinism in your family or you have a child with the condition, you may want to talk to a GP about getting a referral for genetic counseling. A genetic counselor provides information, support, and advice about genetic conditions. For example, you can discuss with them how you inherited albinism and the chances of passing it on. Diagnosing albinism. Albinism is usually obvious from a baby's appearance when they're born. Your baby's hair, skin, and eyes may be examined to look for signs of missing pigment. As albinism can cause a number of eye problems, your baby may be referred to an eye specialist, ophthalmologist, for tests. Electrodiagnostic testing is also sometimes used to help diagnose albinism. This is where small electrodes are stuck to the scalp to test the connections of the eyes to the treatments for eye problems due to albinism. Although there's no cure for the eye problems caused by albinism, there are a number of treatments, such as glasses and contact lenses, that can improve vision. A child with albinism may also need extra help and support at school. Glasses and contact lenses. As a child with albinism gets older, they'll need regular eye tests, and it's likely they'll need to wear glasses or contact lenses to correct vision problems. Low vision aids. Vision aids include large print or high contrast books and printed materials. Magnifying lenses. A small telescope or telescopic lenses that attach to glasses to read writing in the distance, such as on a school whiteboard. Large computer screens. Software that can turn speech into typing or vice versa. Tablets and phones that allow you to magnify the display to make writing and images easier to see. Help and support. There's usually no reason why someone with albinism cannot do well in normal schooling, further education, and employment. With appropriate help and support, most children with albinism can attend a mainstream school. You might like to talk to other people with albinism. The Albinism Fellowship has a contact person network that can provide advice and support locally. This is the end of today's topic. Please don't forget to like and subscribe and stay healthy.